Good afternoon, everyone. This is Dr. Tajkarimi. Welcome to Dr. Taj Show. I'm a board-certified urologist in Northern Virginia. I have the pleasure of having a great friend of mine from Brand Alchemy, Jay Vega from Scottsdale, Arizona. He left the heat and came to the rain. So welcome.
Happy to be here, man. So happy to be here.
It's so good to see you. You know,
likewise, man.
You are killing it for us, along with our amazing i2. On YouTube, we have had more than 40 million views in our Instagram channel, and we have close to 30 million views on YouTube. I am so honored that we get more than 50 to 100,000 shares of our videos all around the world. Thank you. Thank you so much. I think it's our pleasure to provide real information, unsolicited information, real medical topics, not really trying to be salesy and try to inform you what are the pros and cons of different things that are marketed by major companies, try to change your anatomy in a bad way. You know, you have so much experience with fillers. You have dealt with people that do a lot of permanent fillers like liquid silicone, and you have seen all the disasters. And firsthand. My goal is, a lot of people want to enlarge their penis. I get it. First, you have to improve your confidence without having to worry about whether you're thick or long. Your confidence. I will tell you right now, in my practice, the best and most successful patients are the people who have a normal penis, but they have the most amazing life and they are doing fine. They have the most beautiful girls. It's not the size of your penis that will make you confident. It's you yourself and your self-worth. However, if you are planning on improving your girth, you want to have a longer penis, what are your thoughts? I mean, you have seen it all. Tell me, what are the things that has really stood out for you?
Man, seeing this procedure here is completely different from anything else that I've seen. And like you said, I've been in countless procedures where I've seen people do it cosmetically. Number one, when we talk about from a confidence standpoint, right? Just looking at the result after that, you know as well as I do, I couldn't look at that myself. I can't imagine a woman looking at that.
Yeah.
That's that. I mean, or your partner looking at that. That's number one. But as you said, like, this right here is leaps and bounds above something that's, those cosmetic procedures really don't add any benefit to that, right? It's almost like as if you took, you blew up a balloon and put it under your shirt and walk around like if you had muscles, right? There's no added benefit to that. This right here, if more people knew about this, right, which we're doing an excellent job of doing that, but the more people that learn about this, it's going to continue to improve so many men's lives. I can't believe the efficacy of this thing right here.
So you're talking about the 3-piece penile prosthesis.
Yes.
Let me tell you a quick rundown. If you are, let's say a patient comes in and is taking Viagra, Cialis, because they're not getting stiff erections, and they're not getting really hard, they are failing therapy, they have high blood pressure, they're diabetic, they have had prostate cancer treatment, they're getting older. A lot of men are dating and marrying younger women who are sexually, they need to satisfy. Let's say you take Viagra, Cialis, and you're getting not very strong erections. You don't have a lot of options. And I will tell you that the 3-piece penile prosthesis by a high volume surgeon is a transforming procedure. It changes your life, and it's quickly, within 35 to 45 minutes, you can make a tiny incision and place an implant underneath. It's all your own penis. And 3 weeks later, let me tell you, as soon as you want to have sex, you just push a few buttons, you have a very powerful erection with all your sensation, orgasm, everything intact. You can have sex for hours. And patients who come to me, they're like, Dr. Taj, before I took a Viagra and it was like a rolling a dice. Am I gonna get an erection? My wife is in the other room. She's like, honey, are you ready? I just showered for you. I put on a G-string. And I'm like sitting in my room, I'm like, fuck, I can't get a strong erection because the Viagra is not kicking in. And then I go in and I say, hey honey, let's just cuddle and let's kiss, but I can't really enter you. Or if I enter you, it's a flimsy erection. It only lasts a few seconds and boom, it's gone. With this, there's no cuddling. You're pure fucking. You're gonna be fucking like a porn star. So you are just having the perfect erection. In general, the satisfaction rate for a 3-piece penile prosthesis is more than 97% for the male. And it's 98% for the partner of the person. The partners are like, I talk to the wives of my patients, and I have hundreds and hundreds of female patients that I talk to. They're like, Dr. Taj, you have no idea the confidence he has.
Absolutely.
He walks into the house like he's the king. Before, he was like a pauper. He walked in like hiding from me. Now he's like, honey, get yourself ready. We're gonna be making love. And I am seeing all these patients like, Dr. Taj, I'm going on a cruise. I paid all this money. Please do my implant before the cruise so I can make love to my wife. It's so touching to hear this. The key point to a 3-piece penile prosthesis is the sooner you get it in. Penis has a lot of smooth muscle tissues that need blood supply. If you're not getting a lot of nighttime erections, nighttime woodies, and you're not getting stiffies in the middle of the night, you're not getting the adequate nutrition, blood supply to the penis. So the penis will begin to undergo atrophy. You will start losing length. A lot of patients say, Dr. Taj, I've had ED for 5 years. I used to be stretching my penis to 7, 8 inches. Now I'm like 5 inches. It's because it's called disuse atrophy. Like if you don't go to gym and do biceps, and then 5 years later, you look at your arms, you're like, what happened to my arms? I used to be like nice arms, now I have nothing. It's the same concept. So patients who fail oral therapy, they need to either decide whether I want to give up or should I do something. A lot of people, they spend tens of thousands of dollars doing shockwave therapy, PRP, fine. You will spend all that money. Most likely 99.9% nothing will happen. So you drop 10 grand already, and then you need to be educated about this amazing procedure. So penile prosthesis is a 45-minute procedure that will, within 45 minutes, will transform your life.
It's life-changing, literally life-changing. I have a question. You mentioned earlier about this being done by a high-volume doctor, right? What's the difference between a high-volume doctor and somebody that maybe only does a few of these?
Do you have kids?
Yes, 9.
So 9 kids. So listen, do you have a daughter?
I do.
Okay, so your daughter is reaching 16 and she has a bump on her nose.
Okay.
And she's like, Dad, I need this fixed. My nose, I need a rhinoplasty. Now, let me ask you a question. Would you go to a plastic surgeon who does 3 rhinoplasties a year, or would you go to a rhinoplasty doctor who does hundreds a year?
Obviously hundreds.
For your daughter. And same concept, is your penis.
Yeah.
You have to go to a high volume surgeon because we know and predict how to maximize your length, your girth, how to prevent complications that can cause infections, how to manage any prediction of any issues, curvature, same concept. Multiple studies have shown that high volume surgeons have better outcome and less complications. It's very simple. In my opinion, a best surgeon is someone who does at least 25 to 30 minimum a year.
Okay.
And even better is someone who does 50 to 100 a year.
But how would somebody find, like, how would I find these types of surgeons, these high volume surgeons?
Let me tell you a funny story. I just talked to a gentleman. You were in my clinic today. I just posted about 6 penile implants. Okay. One of the patients had gone across the street, which is another urology group, and had expressed that he has ED. and she said, "Oh, we are the best in the area," which is not true, and you should come to us. And he said to her that also I have an interview with Dr. Taj, and she goes, "Oh, Dr. Taj is, you should come to us." So the question is, that person has only done 3 a year. 3. She does 3 a year, versus I do 10 a week.
Wow.
So that is the difference of expertise.
Absolutely.
You have to choose. For me, losing that patient is not going to change my practice. Fine. I mean, patients can go wherever they want. They can go to the moon or Mars or some other galaxy. It doesn't change my practice. But high volume really matters for this type of case. It's really crucial. We have assembled the best of the best penile implant surgeons in the United States. The ones that are doing more than 80 to 100 to 200 cases a year. The best. Wow. We're talking about the Jean-Claude Van Damme, Steven Seagal, Bruce Lee, the best of the best surgeons that are like the superheroes of this surgery, who have been fundamental in increasing the efficiency of the procedure, increasing the outcome of the procedure, the ones that can do the surgery with one hand and their eyes closed.
Gotcha.
And we put them all in Edinvitality, which is a new company that has been formed. It's a educational company that you can go to edinvitality.com, and it will basically educate you about what is the benefit of penile implant. And it's basically, we're not selling PRP, we're not doing shockwave, we're focusing on penile prosthesis. We're the first company that is fully focused on one procedure that we do extremely well.
Love it.
Because no one is entering this group of elite surgeons without being the absolute best.
So these guys are all vetted.
We are vetted and we are already well known. And you know what? The surgeons in Edinvitality perform 70% of all penile implants in the country.
Wow.
That means we're talking about 50,000 surgeries combined performed by these surgeons. The absolute rock stars of this surgery are in there. I am proud and honored to be one of them. Okay, but I will tell you, the names of these doctors are like everyone knows them. So what have we done is make it easy for patients to find the trustworthy surgeons that have the best outcome without having to worry about anything else. Now, the status of insurance coverage for the penile prosthesis is dramatically changing. The landscape is changing. Unfortunately, a lot of insurances have dropped coverage of the penile prosthesis. So many men that need this procedure are getting denials because their employer has exclusion clauses, or they have high deductibles, especially with the new changes that are happening in healthcare. Most cosmetic and quality of life procedures are being dropped by insurances because the insurances don't have any money anymore. You will not believe this, that almost 30 of my patients who had surgery last year with insurance, and they were approved by the hospital has not been paid yet by the insurance. Wow. So the hospital is sending collection letters to my patients, $30,000, $40,000, $60,000 bills. Wow. I've never seen such nasty letters from insurance, from hospitals to my patients saying that your insurance didn't pay for it, you need to pay us or we'll send you to collections. Insurances are dropping this, and patients, a lot of them, they want to do this discreetly because it's a private matter.
Of course.
They want to be able to have the surgery by the best surgeons with the best outcome, best girth and length preservation. They want to have a concierge experience. They want to have a private experience. They want to have the proper follow-up of a company. So this is the difference. You may go to the best surgeon, but he may have a very crappy post-op follow-up. Once you're done, adios.
Yeah.
We don't do that. This company will follow patients for years, make sure that they're satisfied. We have a 24-hour a hotline for, issues and complaints about, issues that we can manage without having to wait for 48 hours for your doctor to contact you. Beautiful. And it's all a clinical pathway based on studies that have been published of how is it that we can take a patient from pre-op to a successful post-op with excellent outcome, no infections, no bleeding, no complications. So that's what Edinvitality is. The best and the highest volume surgeons under one roof to serve patients who are either rejected by insurance, or they want to be out of pocket, or international patients. Every week I have 1 or 2 patients from Canada who flies from Montreal, from Toronto, who want to have a penile prosthesis because Health Canada, I have patients who are told, okay, you want a penile prosthesis through our insurance system, come back in 2035. Wow. And the patient is like, what are you talking about? I'll be dead in 2035.
Or divorced.
Exactly. So, I think Edinvitality is a one-stop shop for patients. And we have surgeons in almost all of the locations within 500-mile radius of anyone. And you can go to any of them. I personally, if I have erectile dysfunction, I can close my eyes and you can put the names of these superstars and I can put my hand on any of them and say, you know what, I don't care. I close my eyes and I will open my eyes and I will choose that surgeon.
Absolutely, man.
I will go to sleep in any of these beds of these surgeons. I would be probably hesitant of maybe other surgeons, not all, but I would not go to a low volume surgeon. And there's no disrespect. If you're a good stone surgeon, stay as a good stone surgeon. But if you're doing less than 25, 30 penile prostheses every year, you're not getting the experience of someone like these superstars that are doing hundreds a year. It's just that simple. It's statistics, man.
So benefits are, right, stronger erections, right? More confidence. I mean, we know
not
that as
stronger
men.
erection, unlimited erection.
Unlimited erections.
Unlimited.
So if I want to have sex for 5 hours, like I did in my 20s,
you can have sex until your wife has smoke coming out of her ears, like you broke something. No, you can have sex all you want. You can line up 30 girls and fuck each and every one of them.
Can you imagine? Can you imagine? Seriously, because we all know every man has had at least one instance in their life where it's like, come on, don't let me down, right? I mean, it could be anything. It could be stage fright. It could be, maybe you're doing something in a public space or whatever. We've all had that feeling, but I couldn't even imagine that feeling every night.
You can keep coming.
So sensation and everything is good.
You can keep having orgasm and your erection won't go down. You only bring it down when you and your partner say, honey, are we done? I mean, are you like, did you have 17 orgasms? Yes. No.
And how comfortable is this when they're not erect?
You can walk naked into a locker room. Nobody will know that you have a penile prosthesis because we always hide the incisions. Mm-hmm. Nobody will know. Now, again, I have to clarify. Mm-hmm. You have to go to a high volume surgeon.
Absolutely.
I had a gentleman coming from Texas last week. He had surgery. They put the implant in the middle of his penis. So the half of his penis was like free. And he said, Dr. Taj, I can't have sex because it's like my penis goes in like this, and I'm having sex with my penis bending because that doesn't have erection. So to answer your question, fundamentally important that you go to the right surgeon who knows how to dilate to the right amount. That's why I post hundreds of videos on YouTube showing all the surgeries to make sure that you understand that implant has to be put in correctly and perfectly. And Edinvitality surgeons are the masters of this procedure. That's why Edinvitality is a one procedure company. We do one thing and we do one thing extremely well.
Mastered it.
When you come to Edinvitality, you can close your eyes and know that you are being treated by the absolute best surgeons. That's it. even if you live in Australia. I had a gentleman, let me tell you a funny story. I think I've told that story. This guy is a handsome gentleman with an Australian accent. He's a Crocodile Dundee kind of guy. He lives he has some kind of a bed and breakfast in the middle of nowhere, like 1,000 miles of nothing, and in the Aborigines, in the bush.
Yeah.
And he gets all these tourists that are young British and European girls riding their Jeeps, Wranglers. They come and they want to sleep in his bed and breakfast. And he says, Dr. Taj, I'm 63 years old, and all these 24, 23-year-old girls, they want to fuck my brains out, and I cannot do shit. Wow. I have ED, and it's so frustrating. So yesterday, I just saw him. I took out his drains. The week before, I had done his Kingmaker surgery.
Wow.
Kingmaker is the combining of the 3-piece penile prosthesis with the implant. So his penis is much girthier and much longer.
So we're doing length and girth.
Length and girth and ED. ED. So now he is a lethal weapon. So the Kingmaker is the combination of the 3-piece penile prosthesis and the implant. So you get the additional girth. But the Kingmaker is the only surgery that I am performing now. Nobody else is doing it. Is combining the 3-piece penile prosthesis with the implant. So I put it in. I'm like, listen, when you have your guests coming in,
they're not gonna leave.
They're not leaving. They're not leaving. They're gonna have the whole Crocodile Dundee experience. Not the half. Remember when he was pulling out his knife? Goes,
this is a knife.
It's gonna say this is a dick. Boom! He pulls it out like this.
I love it, man. I love it. The Kingmaker is an exclusive Dr. Taj procedure.
Yes, so this is what I've been doing. I try to always innovate things, push the envelope, look at possibilities. Yeah. I have performed thousands of the implant, and I've performed thousands of this. Separately. Now, I have been doing the implant, and then 3 months later doing the 3-piece. Okay. But recently, because patients are coming from around the world, I'm combining both. Now, it has to be the right candidate. Okay. You have to be the right anatomy. You have to be a healthy person to make sure that you can handle all this in there. But, the penis looks completely natural, but it's just much girthier. In general, all of my procedures is done on patients who are emotionally stable. This is very important aspect. Okay. You don't want to be putting this stuff on someone who has unrealistic expectations, patients who have severe anxiety disorder. You want to make sure that they understand this is a procedure to improve your quality of life. It's not going to dramatically solve all your problems.
At the age we reach, when we can remember our parents being that age, our lives are way more active. So this is so incredibly important. Not just for men, but for their partners as well. This is so important for that quality of life, right? I mean, you see people out there hiking, they're on jet skis, they're riding ATVs in the desert, and then after all of that excitement, you want to go home and finish the day.
Absolutely. Your health. Healthy men typically don't have ED. Very healthy men. Unless if they get prostate cancer or some kind of an injury or something. However, men in their late 50s, 60s, 70s, 50% of men in their 50s get erectile dysfunction because of diabetes, hypertension, aging, poor nutrition, smoking, heavy alcohol use, drugs, obesity. All of these things can affect your erection. So the first step is to improve your life, improve your health, improve your diet, eat better, lose weight. Stop eating those chips. I always tell all these obese patients coming to me like, Dr. Taj, I can't get an erection. I'm like, listen, look at you. You have no confidence. You're 300 pounds. You have fat everywhere. First thing you have to do is get a baseball bat, go to your pantry, and start destroying all the chips and garbage in your closet. And start eating carrots, for God's sake, and celery. And you will lose 3 pounds a week if you do that, and then your penis is going to get better. If those things don't work, and you take Viagra and Cialis, and they don't work, don't waste time. That's my advice. Your penis is going to keep shrinking, and you're going to notice that you are 2 inches shorter 2 years later, and then you come to me for penile prosthesis, and you say, Dr. Taj, I used to be 8 inches, and I'm like, you're only 4. I can only stretch 4. I can do some manipulation, I can do some tricks that only high volume surgeons know, but I cannot make you 8. You should have come to me 5 years ago when you were, this is part of teaching. Your penis will get smaller from ED if you don't get nighttime erections. I'm telling you, people should know this. People, they should have like billboards on highways say, know that your penis will get shrunken if you have ED. Lose weight. Start walking 10,000 steps a day. Lift weights. Gain muscle. Eat well. Cut the carbs. Cut the calories. Stop smoking. Stop being depressed. Stop jerking off watching porn. Start kissing your wife and telling her how much you love her. And check your testosterone level. If your testosterone is low, make sure that you find out why and then get on TRT, because testosterone replacement is going to make you feel more valued, more stronger, more vigor, more horny, all of these things. Then then you see if your erections come back. If they don't come back, go to see a high volume sexual medicine expert in your area. Tell them, I need to do a penile duplex ultrasound. Find out whether you have arterial problem or venous problem. If you have curvature of the penis, go to an expert. I'm just giving you step by step. Number 4, find out if you can take Viagra and Cialis without any contraindications. If you're diabetic, get your sugar under control. For those of you watching this, if your hemoglobin A1C is above 8, you're gonna die. You need to walk, you're gonna die soon. You gotta drop your hemoglobin A1C. You gotta stop eating junk, control your sugar, fire your internist. If they're not controlling your sugar, fire your internist. Go find someone who's gonna bring your sugar down. Start getting the baseball bat, destroy your pantry, stop hiding that 1 gallon ice cream in your freezer. Okay, I'm talking to you. And then go see an expert. If you take Viagra and Cialis and it's not working, go to Edinvitality.com. Talk to them. Get connected to the high volume surgeon. You don't have to choose them, but they will evaluate you and tell you that this is how they can help you.
So let me ask you, you say if you're using the ED meds and it's not working for you, but what if I'm a patient and I can't use the ED meds because of a heart problem or because I get terrible headaches? I read things where people say they have these rushes of headaches.
30% of men taking Viagra and Cialis they don't even respond. 70% fail after 5 years because your body stops working.
Plateaus, right?
You're absolutely right. A lot of patients come to me, they're like, Dr. Taj, I take it, I get the most horrendous headache, I get visual changes, I get a runny nose, I get back spasm, I don't tolerate this medication. Yes, you can do a penile prosthesis. American Urological Association recently changed the AUA guidelines that if you have erectile dysfunction, which is defined by inability to obtain or maintain adequate erection to your satisfaction, you should consider oral therapy. And let's say you have already changed the lifestyle changes, lose weight, eat well, exercise, control your blood pressure, control your diabetes, all of these things, and it's still not getting erect. You can take Viagra or Cialis or these meds. You can do injections, and you can do a penile prosthesis. Penile prosthesis is not the last resort anymore. It used to be like 20 years ago. And exactly who is the best surgeon to go see is the Edinvitality doctors. Because believe me, those surgeons are the Kung Fu masters. They're Tai Chi masters. They're not going to be fumbling around you will get the best outcome. You only have one dick. You got to choose the right surgeon.
Absolutely, man. Absolutely.
You don't have two dicks. You know, don't believe those like porn movies. That's a fake shit. So now, what is the problem with injections? Injections, I just saw a gentleman today. He's only 39 years old. He's been using Bimix, and I only gave him Bimix like 5 years ago because he injured himself with rough masturbation.
Okay.
And his penis came back 5 years later. I'm like, where were you? He goes, Dr. Taj, I was scared to come to you. I'm like, what? Why are you scared? He goes, I fucked up my penis. I'm like, what did you do? He goes, I went to these needle junkie clinics and they kept giving me Trimix. Now my penis is all crooked. It's all fibrosed. I have big lumps on my penis. I'm like, why didn't you come to me? He says, Dr. Taj, I was afraid that you were not gonna like me. I'm like, why? What is it that you did? He goes, I've been injecting Trimix and now my penis is shrunken. I went from 7 inches and used to have a huge penis. Now it's like 5 inches. And I'm like, what did you not come to me? He goes, I'm afraid. I was afraid of getting a penile prosthesis. I'm like, why are you afraid? You already messed up your penis. If you had come to me 5 years ago, I would have put a massive implant for you. You'd be like a rock hard. So guess what? Now he's getting a penile prosthesis. 5 years later, 2 inches shorter. Edinvitality, take a look at it, man. By far, the most innovative modality for patients who fail oral therapy. And they want to be private, discreet, and they want to be self-pay. Now, if you have insurance like Medicare, you should go to a high-volume surgeon. Even some of the high-volume surgeons in your area that are accepting Medicare and are doing Medicare surgery, or if your insurance accepts it, fine. But 60% of insurances are now denying the procedure. Yeah. So where do they go? They don't know where to go. Some hospitals are charging $85,000 to $150,000 for self-pay. That is ridiculous amount. That's because crazy. Once they have you by the balls, they have you by the balls.
Literally.
Literally. Well, listen, great to see you, man.
Always, man. All right, always.
I'm going to take him to a nice Persian restaurant right now.
Absolutely.
All right, let's go.
Let's get it.
Thank you.